And Edwards, thanks for being with us this morning. And it's important for parents to start thinking about what they need to do to get their kids ready for school. Now, this includes buying school supplies and making sure you have all the medical needs met for your kids. And here to discuss the immunizations part of that, which all schools require for attendance, Dr. Sherman Alter, from Dayton Children's Hospital. Thanks, Doctor, for joining us again this morning. We do appreciate it. First off, tell us the importance of vaccinations.
Well, I think the main thing to consider is the fact that we don't see a lot of the diseases that these vaccines prevent is due to the fact that we vaccinate children. So as long as we maintain a good population of kids that are vaccinated, we no longer will see those dreaded diseases that we used to see many years ago. So it's extremely important, particularly when children start getting together in the school.
Some parents choose not to get their children vaccinated. Good, bad?
Well, there are rare contraindications, and those kids probably shouldn't be vaccinated, but the vast majority of children need to be vaccinated. If that proportion of kids that aren't vaccinated increases too high, then you have a very susceptible population. If a disease is then entered into the group, say someone traveling and brings their measles, all those kids that aren't vaccinated will get measles. So it's critical to maintain a high proportion of children that are vaccinated.
You mentioned something to me before we went on the air about you are seeing an uptick in whooping cough incidents. Does this concern you?
Well, that's exactly right. In the United States, in the last 2 years, the entire country, we've seen very high numbers of whooping cough. Numbers higher than what we've seen in the last 20 to 30 years. Now, here in Dayton, we've always had an ongoing problem with whooping cough, not a huge problem, but in the last 3 months, we've seen a definite increased number of cases in all ages. Young children who may not have been vaccinated, school-age kids, as well as teenagers that get it. And the sickest patient with whooping cough will be the very young babies. So any other age group that gets it, including adults, if they infect a child, that child could be very, very ill. So yes, we have seen increased whooping cough.
What should a parent be looking for, maybe if their child has what they think might be whooping cough?
Yeah, whooping cough is pretty obvious when it gets into this full-blown disease. It's a very strong cough, frequently associated with, at the end of the coughing episode or paroxysm, choking, color change. Sometimes the children throw up, and they look miserable. So if it's a very unusual cough, then their doctor ought to be contacted.
You also mentioned something about we should vaccinate our children for the flu each and every year.
Yeah, the recommendations in the last few years have been influenza vaccine for every person older than 6 months, which includes every school child. Each year. The vaccine is modified every year to hopefully address the strain that's circulating.
Sure.
So, I can't get a vaccine 3 years ago and expect protection now. So you have to receive it every year. It's a tough issue, I think, to bring every child in to get a shot. But it's important that we do that. We try to do that.
Financially, it's got to be a bit of a hardship, I would imagine.
Yeah, it is. But I think it's all risk versus benefit.
Sure.
And I think that if you look at prevention of flu in a child, it prevents that child from missing school, from the parents from taking off work, for any medications that are needed. So, in the long run, I think if you can prevent flu, it probably is a cost savings versus if you actually get influenza.
All right, Dr. Alter, thank you so much for joining us. Always good information that you share. We appreciate that.